I'm Jordyn and this is Josie. She'll be my patient today. And I'm going to do the skin, hair, nails, and head assessment. So, neck. First, I would knock on the door, enter the room, and I would introduce myself. I'm Jordyn. I'll be your nursing student today, and I'm going to do your skin, head, hair, nails, and neck assessment all in one. And I would have my patient tell me her name and date of birth, and I'll check it on her wristband.
Josie Anderson, 3/13/2000.
Perfect. From there, I would wash my hands and put on gloves. I would make sure that my patient is adequately exposed for the assessment, which she is. I'd also make sure that she's sitting in a comfortable position where I can assess her. And lastly, I would ask if she's in any pain. Can you rate your pain on a scale from 0 to 10 today?
0.
Perfect. So let's go ahead and get started. First, I'd start with the skin assessment. So just generally looking over the color of her skin, which I would say that her skin would call it kind of pale, but with red undertones and peachy undertones. I'm also going to look at the overall temperature of her skin. So I'd feel with the backs of my hands and just make sure that her skin feels about the same temperature. There's no abnormally warm spots or cold spots. I'm also going to look for darker areas or blue areas or reddened areas of the skin. So just using my visual assessment, looking over all of her skin, on the back, down the arms, everything looks to be pretty evenly pale with her normal skin color. After that, I would also assess her skin for any hardened areas. So just feeling all the way down her arms, feeling behind her back for any bumps, looking for lesions as well. Don't see anything. It's very smooth, very even texture. Also assessing for excess moisture and dryness, which her skin is very supple. It's not overly moist or dry. I'll also test her skin for turgor by pinching a little skin here at the clavicle, and it goes right back to normal, just like how it was before I pinched it. Also, when I do her skin assessment, I'm just going to come down to see her nails. So looking at the nail beds themselves are pale pink, and the nails are also clear. They're very smooth. There's no deep ridges or anything. They're rounded, and the capillaries refill in less than 1 second. So I'd also look at the toenails as well to assess those. I would go take looks down her legs, looking for any lesions. I'm not really seeing any besides just generalized freckles. Other than that, they feel about the same temperature all the way down. I don't see any open wounds or anything like that. I'd have her extend her leg and put my thumb over the bony prominence on her ankle and just leave it there for a couple seconds. And when I release my thumb, there's no pitting left, so she doesn't really have any edema on her legs. Looks great. Then from there, I would move to her head and assess her head. So I would just use my fingertips to search her entire head for anything like bumps or divots in the scalp or in the skull, and make note of those. So starting at the front, just using my fingertips to run them through her hair. Also noting her hair color is very even, it's red. Her hair texture is very soft and it's thicker. Not feeling any abnormal bumps on her head, so I would say that it's atraumatic. And noting the symmetry of her head and the size, I would call that normocephalic because it is proportionate to the rest of her body size. Also noting for any spots of alopecia, which I don't see any. Her hair is distributed very evenly over her scalp. After that, I'd move on to the face and do my assessment there. So I'm just gonna observe her face for being symmetrical. So just checking out all of her facial features and making sure that they're symmetrical, which they are. So I would say that they're symmetrical. And then also looking at, we'll test her cranial nerves while we're at it. So I have a cotton ball, but I have a tissue. So I'll have her close her eyes, and I'll instruct her to point to where on her face she feels me do the touching. So that was cranial nerve 5, and I would say that that nerve is intact because she correctly identified where I touched her face at. Next, I would test for cranial nerve 7. So that is going to be me asking her to make a bunch of weird faces. So make these faces. And then I'd have her blow a bubble in her mouth, and I'll push it out and make sure that it feels of equal strength on both sides. And then I'll have her close her eyes, and I'm going to try and open them and just try and keep them closed. Great. So I would say that cranial nerve 7 is also intact. After that, I can move on to the neck. So the neck, I'm just going to make sure that it looks symmetrical, which I'd say that it does. I'm also going to palpate the trachea, and I'm just feeling for anything abnormal, which I don't feel anything abnormal, and it is midline. The trachea is midline. After that, I would test her range of motion of her neck. So put your chin to your chest, look up at the ceiling, put your ear to your left shoulder, to your right shoulder, look to your left, look to your right. Looks great. I would say that she has full range of motion for her neck. And then lastly, I would test cranial nerve 11 by applying some resistance and asking her to turn her head. So turn your head towards my hand. Great. And then the other side. Great. And I'd say that cranial nerve 11 is intact because she was she showed equal strength on both sides. And then after that, I would document all my findings from this assessment, remove my gloves, and perform hand hygiene, and that's it.
That was pretty good.